Hemorrhoids, you may be sitting on one right now. I'm Dr. Paul Zalzal.
I'm Dr. Brad Weening. Welcome to Talking with Docs. Today we have a guest.
I'm so excited.
A general and cardiovascular surgeon has come to join us, Dr. John Chuback. Welcome, John.
Hang on a second. Why do we have a cardiothoracic surgeon talking about hemorrhoids?
Because hemorrhoids is an issue with your vessels, with your veins, actually. We're going to get all into that. We're going to talk about what it is, why it happens, who gets it, and how to potentially treat it.
Dr. Chuback, welcome.
Thanks so much for having me, guys. It's a lot of fun.
In a sentence, tell us about yourself.
Well, as you said, I'm a general surgeon initially by training, and then after general surgical training, you go on to subspecialty. In my case, it was cardiovascular and thoracic training. And so I've done all kinds of vascular surgery, anything you can imagine, from open heart to peripheral bypasses, carotids. But one of the kind of down and dirty jobs of vascular surgery is hemorrhoidal disease.
Okay, let's go. What is a hemorrhoid then?
So a hemorrhoid is actually, we refer to them as sort of cushions of tissue. Now, primarily there's a vascular component, this venous component that's in the anal canal, and they, like all other veins, they draw blood away from that area, which is a really important job because, as you know, that's a dirty area. There's a lot of potential for infection, bacteria, et cetera. So the vascular system is really, really key in making sure that that area remains healthy with excellent blood flow. And that means there are vessels that bring blood flow in, but also these hemorrhoidal veins that take blood flow away. So that's very, very important. But the other thing that the hemorrhoidal cushions do that a lot of people are not aware of is that they actually create sort of a gate, if you will, to the function of the anus. And there are sphincteric muscles that keep the anus closed so that your underwear and so forth stay clean and you maintain control of your bowels. But those hemorrhoidal cushions, they fit together almost like a little jigsaw puzzle. And it's 3 bundles, and they lock together to keep the anus closed and clean. So there's more than just the vascular function, there's also a mechanical function.
Okay, if you're taking notes, hemorrhoids are vascular structures that do serve another function as well. Okay.
And so what a hemorrhoid is like when that vein dilates, right? So veins are low pressure. It's a low pressure venous system, so it's on the right side of your heart. So it's low pressure, but as they dilate due to straining and a bunch of other factors that we'll talk about, they get big. Right, and there's both internal and external ones related primarily to their anatomy. What's the main difference between the internal and external hemorrhoids, John?
The internal hemorrhoids are above what we call the dentate line or the pectinate line, and the external hemorrhoids are below that. And why that's important is below the pectinate line, there is what we call anoderm. It's a kind of modified skin on the very, very last portion of the anus. And that anoderm is somatically innervated, meaning that those nerve fibers, those nerve endings are sensitive to stretch, pressure, and temperature and pain. It can be a very painful area. Above the dentate line, which is sort of a jagged line, which is why they originally called it that, above the dentate line, there's a different kind of mucosa called columnar or transitional mucosa, and the innervation of that area is what we call visceral. So it's a different kind of innervation, and in that area you don't have pain, which also opens things up to different treatment options for above the dentate line and below the dentate line.
Okay, all right. So right now, if you're sitting on a hemorrhoid, you're probably like, I don't care about any of that stuff. How do I know I have a hemorrhoid, and what can I do about it?
Yeah, so let's start at the beginning. How does a patient show up in their doctor's office saying, hey, I'm concerned about a hemorrhoid, or why would someone think that they have a hemorrhoid? What does it look like?
Well, number one, you could feel it. So let's say when you're bathing or when you're cleaning your backside after a bowel movement, you might feel a lump there. And that can be very, very anxiety provoking for people because the first thing you might think is, oh my goodness, I hope I don't have a tumor, I hope I don't have a cancer. Right. It can be very painful, can also bleed. The typical bleeding associated with hemorrhoids is bright red blood. That's an important thing to know. And also, and again, your colorectal surgeons who come on the show and everything will tell you this, it's important to look at your bowel movements for a number of reasons, but you want to make sure there's not blood with your bowel movements. So typical of hemorrhoids would be bright red blood mixed in the toilet water and also along the outside of the stool, as opposed to a black stool or a maroon colored stool, which could be an indication of other problems. But bleeding, pain, a lump in the area of the anus, these are the first things that trigger concern.
Okay.
So I think I've got a hemorrhoid. It hurts. I'm not happy. What can I do about it? I'm going to go see my doctor. The doctor is going to presumably do a history, physical examination.
Right.
What kind of things are they looking for in that encounter?
Yeah, a good doctor, and hopefully you're going to find a good doctor, is going to be very thorough and do the things that you just mentioned, Dr. Zalzal. They're going to do a thorough history and a physical examination, which unfortunately, as you all know, is happening less and less. But patients should insist on being examined. It's very, very important. It's 101 in good medical care. And to look at the area, and to palpate the area, to do a digital examination of the area, and make sure there aren't other gastrointestinal symptoms that might indicate a more serious problem, like a cancer, like Crohn's disease, and other problems. But an examination should easily lead the physician or a qualified healthcare practitioner to see that, this is hemorrhoids.
And when you say a digital exam, what that means is a rectal exam, or a DRE, not Dr. Dre, like the rapper, the very successful entrepreneur and musician, but a digital rectal exam. So where a finger is inserted in the anus, because about 50%, if I remember from residency, 50% of rectal cancers are within the reach of your finger. So this is one way to rule out that, to physically have a look at it, and then you're more looking for the external hemorrhoids at that point. If you're looking beyond, in order to see the internal ones, would you have to consider something like anoscopy, like a minimally invasive investigative test that you could do in the office potentially?
Theoretically, yes, but for symptomatic hemorrhoids and hemorrhoids that bring patients into the doctor, believe it or not, based on the staging of hemorrhoids, some of those internal hemorrhoids can do what we call prolapse, or protrude or bulge outside of the anus. So a physician could potentially see an internal hemorrhoid hanging out, kind of like a little cluster of grapes, and that becomes important in terms of staging the hemorrhoids. There's stage 1, 2, 3, and 4. Stage 1 means they don't bulge. Stage 2 means that they bulge with a bowel movement, but generally they pop right back in by themselves. Stage 3 means that the patient would have to digitally, meaning using their finger, push them back up inside, which doesn't sound very nice, but it's true. And then stage 4, what we call irreducible. They've prolapsed and they're so large that they're always hanging out. And those kinds of hemorrhoids will certainly often bring patients to the doctor for help.
Okay.
Thanks for ruining grapes.
Sorry, everybody.
Sorry if you really liked grapes. You probably don't like them.
You still got green grapes. You're
That's
still
right,
okay with the green. You're okay with the green ones.
Go with the green grapes.
All right. So I have a hemorrhoid. All right. Now, what can I do about it? This is what I really want to know. This is why I'm watching this video. What can I do about these hemorrhoids?
Well, it starts with...
I don't. This is hypothetical for the purpose of this talk.
The other thing we should say quickly, though, is that it's very, very common. A lot of people have them. A lot of people have low symptoms, but most people at some point in their life would likely have a hemorrhoid potentially, and it usually happens as we get older, but there are some risk factors. So age would be one, low fiber diets would be another, people that strain a lot, so even weightlifters, young people that are lifting heavy weights and performing Valsalva maneuvers, that increases your risk, as well as the other group would be the people that have pregnancy. Pregnancy is a known risk factor for hemorrhoids, so it's very, very common. So now you got a hemorrhoid, you're at your family doctor. What can we do to help reduce the symptoms from our hemorrhoid?
Well, the first thing I would say is that's all absolutely true. So don't be embarrassed about going to your doctor for hemorrhoids, because you want to get treated and you want to feel better and you want to make sure it's not something more important. Right. My father was an obstetrician. I can tell you, he treated a lot of hemorrhoids and sent a lot of hemorrhoids to general surgeons and so forth. So especially young ladies who may have had one or more pregnancies, please don't be embarrassed. Let your doctor know and let him help you with that. The basic things that we always used to talk about as residents in the general surgical clinic, it's sort of a mantra, is high fiber diet. You want to take that naturally, but you may also need some fiber supplementation in your diet, like psyllium, things like Metamucil, et cetera, certain cereals that are very high in fiber. And then oftentimes topical things like creams, ointments, Tux pads, things that have witch hazel or have Vaseline and different things to basically soothe symptoms. And then, of course, there are dietary supplements that you can take internally, like micronized purified flavonoid fraction being one of the best, and horse chestnut that have been studied extensively to support hemorrhoidal vein health.
So let's talk about this. So first of all, totally agree. We would always recommend our patients try to get things from your food if you can, but particularly the standard American diet is devoid of fiber and a lot of flavonoids like you're talking about, and there is good evidence for this. And you have a special interest in flavonoids. Can you tell us, a little bit about what flavonoids are, how they work, and your specific interest?
Yeah, you know, as a vascular specialist who really focuses on vein disease, it came to my attention more than 10 years ago that flavonoids, bioflavonoids, you'll hear them referred to all of these things, all the same thing. These are naturally occurring compounds that exist very, very commonly, especially in the rind of citrus fruit. I know Dr. Paul likes lots of tidbits. The flavus comes from the Latin, which means yellow. So all of these brightly colored citrus fruits, orange, green, yellow, etc., they have flavonoids in that element of the rind where the color exists. And they've been found to be really potent antioxidants, and there's been 40 years of study on flavonoids. This mixture, micronized purified flavonoid fraction, has been looked at extensively for 40 years and really been shown to support the venous system in general, but hemorrhoids very, very powerfully.
Right.
Flavonoid rhymes with hemorrhoid. Coincidence? I don't think so. They can actually help.
Yeah, so a lot of fruits. But you're not telling me to eat the rind, are you? Like it's in the fruit as well, right?
Well, you bring up a great question, Brad, because I know that you're a great proponent of a healthy diet, and that's excellent health advice, obviously. But in order to get the amount of flavonoid that's clinically effective based on many years of research from citrus fruit, you would have to eat the rind. The fruit, the pulp, and so forth, has almost no flavonoid in it. Has almost no flavonoid in it. And you would have to eat literally hundreds of those rinds to get what you would get in a dietary supplement, which is why supplements in general really can be very, very important in the diet.
Okay. Dr. Chuback, you don't know, but you just challenged Brad. He's going to go home and eat 2 pounds of rind tonight.
Well, he won't have any hemorrhoids after that. That's not from the flavonoids, but from the fiber.
You just challenged him. Okay. Right. So we've got some lifestyle things you can do, some dietary things you can do, and then ultimately, if none of this is working and this has gone way too far, surgery is an option, or surgical techniques or interventions.
Correct. Interventional techniques. That there are a number of them. One of the most common that can be an in-office procedure would be banding. Now, banding is, they're tiny little bands. They look like the rubber bands that kids would put on their braces.
And don't mix those up.
Don't mix them up. And there's a very simple device that applies those, and it's a little trigger mechanism that springs that Band-Aid around the neck of the hemorrhoid to kind of choke it off, and then it dies off, it withers away, and it gets sloughed away. But that has to be done above the dentate line for internal hemorrhoids only. They can only be so big for that to be an appropriate treatment, but that works very well, and it's painless. Anything below the dentate line that's going to be involving the anoderm, where you have that somatic innervation, those can be really painful. I mean, super painful. And you could see stars, especially if they become thrombosed. Exactly. And so those need to be dealt with acutely. Some people would try to manage those with creams, ointments, etc., but if you're in the hands of a really good general or colorectal surgeon, they're probably going to want to approach that quickly to get you out of that kind of exquisite pain.
It becomes like an emergency.
Exactly.
Right?
So you could either open them and drain them, what we call a thrombectomy, or whenever possible, a mini hemorrhoidectomy, excisional hemorrhoidectomy, where a little elliptical incision would be made around it, including the skin, removing the underlying clotted off vessel, and you may put 1 or 2 loose stitches there, but because it's a very dirty area, generally we leave those open to heal on their own by what we call secondary intention, which usually works out just fine.
Okay. And this is the thing, that surgery is more of a last resort. But yes, it has some risk of infection, some risk of bleeding, and certainly it can be painful and a prolonged recovery. So generally speaking, the first goal would be prevention. So high fiber diet, lots of fluid. Actually, exercise has been shown to reduce your incidence of hemorrhoids, and not, the old wives' tale about sitting on the cold, wet concrete. The cold, wet concrete really is not a risk factor. I did a little bit of a dive into this, but sitting on surfaces that are hard, that actually increases your rectal pressure. So your whole goal is to reduce your rectal pressure. Just like when you're pregnant, you don't want to lie on your right side because that has a baby then lies on the right side of your vein. So you want to reduce your rectal pressure. You want to spend as little time as possible on the toilet. It's like that scene from This Is 40 where Paul Rudd is on the toilet and his wife's like, "What are you doing in there?" And he's playing Scrabble and he's like, "No, I'm just going to the bathroom." And she's like, "No, you weren't."
Up here for a really long time now.
Oh, I'm almost done.
It's the fourth time you've gone to the bathroom today.
You want to have the bathroom a functional place for a limited amount of time. And if you can't go, get up and get moving, because being in that position is actually not good for you, to the point where, I'm not sure if you guys have heard of this. Have you ever heard of the squatty potty?
Yes, of course.
Yeah, so this is a brilliant invention where they made a little stool for your feet because it creates a straighter line for your stool to evacuate easier. So that's something to consider.
One good stool deserves another.
Yeah, it's a really great
There's a
invention.
slogan.
And then the other thing is about wiping. So obviously you don't want to have a rough wipe because that can actually irritate the hemorrhoid, cause bleeding. So some people will talk about either using wet, like baby wipes. There's some studies that have shown that that's reduced the incidence, as well as even a bidet. Just something that actually takes wiping away altogether. In Europe, very common. In North America, less common, but I feel like there's a little bit of a movement, no pun intended,
Right.
for that
And it's
kind
one of the sort of classic conservative recommendations, what we call sitz baths. And those can be purchased pretty inexpensively in the drugstore and so forth, which is really sort of a form of a warm water bidet, which can be helpful.
Okay, one last quick question. What about the over-the-counter things you can buy? I mean, the drugstore is filled with these, like a Preparation H, Anusol, those different topicals you can just buy. Are they worth it? Are they not worth it? Do they help?
Well, I think that they play a role, but they're mostly for symptomatic relief. And again, if you have a thrombosed hemorrhoid, it's probably going to give you very little relief. Internal hemorrhoids, where you don't have that kind of somatic innervation, again, little relief. So there's going to be a role, and I think generally people who begin suffering and they don't know what's going on, they're going to reach out for those things. And if they don't find them effective, they're going to then go to the next step.
Okay, so we've covered a lot of stuff about hemorrhoids. I think one of the big take-home messages you guys brought up too is don't be embarrassed about these. Go get them treated. Most of the time, they're benign entities that are treatable. Occasionally, these can be serious problems. I know every once in a while we see in the OR, we get bumped from one of our cases because someone comes in with a bleeding hemorrhoid.
That happened to me a couple weeks ago. It
Yeah.
became an emergency.
Oh,
Yeah.
are you okay?
No, it wasn't my hemorrhoid.
Oh, sorry. Yeah.
I was waiting to operate, and I
You
got
scared
pushed
me.
out of the way.
I was worried about you.
No, you were
Yeah,
not.
you can have excessive bleeding that can be life-threatening.
Yeah.
So these can be serious things, even though the vast majority of the time they're easily treatable.
I think the other take-home message too with the bleeding is that anytime you have bleeding that persists from anywhere, you should probably have it investigated to make sure, like John had said, you want to make sure you don't have a cancer of some sort, so your family doctor would decide if any investigations are needed. But you don't want to say, "Oh, it's just a hemorrhoid; it's going to go away." You want to, if this happens over and over again, you definitely want to be.
And on the other side of the coin, you don't want to be fearful, thinking it could be something worse, and then you get into what we call avoidance, where the patient doesn't go to seek treatment because they're concerned and they're anxious that they might get some bad news, but neither is a good reason not to see your doctor. Please reach out for help, whether it's because you think you have a minor problem or a major problem. Get the help of a professional. Feel better sooner.
Dr. Chuback, thank you. So in case anybody's watching this while on the toilet, we're going to wrap it up now because you've been sitting on it for far too long. But thank you very much for sharing your expertise in this area.
Yeah, and if you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health.
See you next time.